Welcome, everybody. My name is Raj Agarwal. I work at a company called Panda Health and in a role as a Chief Strategy and Growth Officer. And I have the privilege to be sharing the time today with three experts around the topic of cybersecurity. The title of the topic today is Addressing Healthcare's Human Factors for More Effective Adaptive Cybersecurity. And it's a topic that's really close to my heart because really thinking about technology and the human in the middle is so important. And that's what we're really going to dive into today. So without further ado, I'd love to introduce our panelists today. And let's start with Deb Morrow. Deb, if you would like to just do a brief intro and background to yourself, that'd be great.
Yeah, absolutely. As Raj mentioned, I'm Deb Morrow. I'm the Chief Information Officer for El Camino Health. We're a hospital system, healthcare system in the Silicon Valley. And actually, I have a long tenure in healthcare. I started out as a clinician, as a nurse, and had a passion for technology and the clinical world. And that's landed me right squarely in the seat of the CIO.
Wonderful. Great to have you with us, Deb. Then let's go to Connie Barrera. Connie, would you mind just doing a brief intro to yourself as well, please?
Certainly. Thank you, Raj. My name is Connie Barrera, and I'm the CISO at Jackson Health Systems in sunny Miami, Florida. Jackson Health System is the third largest health system in the country from a bed count perspective. It happens to be a county entity, safety net hospital, and it is a pleasure to work alongside such a dynamic environment. And security is my passion. I've worked in a lot of different roles in IT, but this is a role that you touch every aspect of the organization. And so it's great to be here with all of you.
Wonderful, Connie. And last but not least, Wolfgang, would you mind doing a brief introduction as well, please?
Absolutely. Thank you so much for having me on, Raj. So I am the Advisory Chief Information Security Officer with Duo Security. I've been in this industry a little bit. That probably shows. I started off in healthcare at a regional hospital back when digital transformation meant we were going to take away the typewriters and we were going to figure out how to actually do healthcare on IT. So really looking forward to having this conversation as so much has changed and so much has accelerated in the past couple of months and years.
Brilliant. And I love what you just said there, Wolf, about so much has changed. So much has changed for global society over the last 15 to 18 months, and so much more around technology and healthcare. And so I think this is such an important topic for us to discuss. So what we're going to try to do over the next 40 minutes or so is really talk about identification of cybersecurity threats that the industry feels are most critical to manage. Discover how spammers, cybercrime actors, and other cyber attackers have integrated COVID themes into phishing and social engineering campaigns. I think what's really important here, and as a past clinician as well, analyze which employees and departments are most vulnerable in healthcare, and then putting that together, recognizing how to prioritize threats against one's organization and implementation of best practices. And as you can see, we have great brain trust and expertise around the table here. So why don't we just kick straight into this? And Deb, I'm going to come to you around really the focus around COVID, the concept of remote work, telehealth. It wasn't really that new, but now it is in the fabric of everything that we do. And any other changes in healthcare, how do you think broadly that these have opened up new vulnerabilities in our healthcare organizations?
I think it's expanded our surface, right? We kind of think of our perimeter and what's inside the perimeter. And as we think about individuals working from homes or from remote places, it just expands that surface that we need to be aware of and protect. And I think that's created some opportunities and some challenges for us as we've thought through our ecosystem and technology.
And maybe if I can ask you to go a little deeper on that, Deb, what were your challenges, let's say March of 2020, that you were thinking of when, this very sudden change, I remember it, happened over a weekend. What was keeping you up at night, if I may be that blunt, around security and in your role as the CIO at El Camino?
Well, what always is a great story is fall of 2019, I was trying to convince people that virtual visits were a good thing. It was about a 1% to 2% adoption rate of virtual visits in the clinical world. And my peer group said, why would we want to do that? I don't understand why we need this technology. And so obviously knowing where, kind of having that gut feel of where the innovation is going really helped when March happened of 2020. And in a day, we were trying to stand up a COVID virtual visit on demand type of scenario. I think the risks are obviously when you're thinking about new software and the software that has helped us in this type of a pandemic situation, thinking about the cloud, thinking about the security that you have to be on top of with cloud-based applications. Really, again, expanding out from the perimeter of what you're used to and thinking about how do I ensure that my partners that I'm relying on in the vendor world are adhering to the security standards and best practices. And so that was something that, I think we had to do a bit more due diligence with really vetting out partners and vendors to ensure that they were following the same security standards that we held.
Great, thank you, Deb. And Connie, coming to you in your role as CISO at Jackson Health, in another, as you said, sunny part of the country, how did this kind of change? Let's go back to middle of March 2020. How did you think about this from a cybersecurity and in your role as a CISO perspective for your specific organization? What were the challenges? What did you do about them at a high level?
Absolutely. So I think for us, we are very lucky, which we had already implemented a collaboration platform, and we're very much aligned to be able to deliver telehealth. And, for many years in the past, anyone that had a credential would have been able to VPN. But for the past couple of years, we really, locked that down. So, we had appropriate security awareness training, we had users engaged. But I think the biggest factor, of course, with the COVID anxiety, no one understanding, how serious it was, seeing pictures on TV with folks being carted off in other countries because they were sick or dying, et cetera, the horror that touched people's lives or saw on the television again, really put people in an anxious position. And so, regardless of that, empowerment that many of our users have, everyone was searching the internet for COVID information. And so that's one of the very first things that the adversaries started to attack by, we know historically anyway, about 6 million new websites are spun up every month for malicious purposes. And so COVID was probably one of the biggest, opportunities for the adversary to use something that everyone wanted information. And, they had people just really not even thinking about security at that point, right? Because it's a matter of life and death. So, I think the other factor that was probably impactful for every organization was the supply chain shortages. Of course, we're dealing with many more shortages today in the realm of microchip shortages, even bicycle shortages, there's shortages in every factor. But where we had minimized that VPN surface, all of a sudden we needed to allow for a greater VPN audience. So obviously our user base, I should say. So obviously, we, again, like I said, we're aligned because we had multi-factor for VPN for about 1.5 years or so before COVID hit, but not all of the employees, let's say, that now needed to work from home would have had company issued equipment. So and ordering it wasn't even a matter of you have the money to spend. It was a turnaround time on the equipment that's very impactful. And one thing I do want to mention that I think is interesting on the telehealth is that it's not only the fact that the solution may be robust and a fortress and the organization has every appropriate control and it's functional. But what about the patient device, right? Because many times we don't talk about the patient device as being a huge gap, potentially a huge gap in that security, infrastructure, where the patient's device may already be compromised. And so I think, when we're talking about telehealth and telemedicine, there's a lot that's been done, a lot still to do with storage and application interfaces, and where data is coming from. Android has had leakage of health data that was unencrypted, but the patient device is probably something that most organizations don't talk about, and I think that's huge.
Yeah, it's interesting. You bring something up that whilst there may be some kind of a technical danger, the danger to me is not so much technical, it's more social. It's people making human errors, clicking on a suspicious link late at night. Healthcare workers, they see something, the immediate is, I want to make things better. And, if there's some training I need to click on. And so the key to me is thinking about designing systems that are resilient to people making those mistakes, but also continuously help people be less susceptible to those attempts to gain access to the data. So let me come to you, Wolf, around this kind of, and I'll open it out in a few moments because I think there's value to be had from all of the panel. But how, in your role at Duo, do you think about training employees to be aware of potential attempts to gain access to their data?
There's a couple aspects to that. First, I'm going to say what we have to be careful not to do. Connie mentioned some of the shortages, and there is a tendency when we think about phishing emails to want to assess our organization, right? If we show them a phishing email and we catch them, we can say, look what happened. This could happen next time, and it could be an adversary. And we saw a couple organizations when the shortages for PPE hit. There were organizations where phishing their nursing staff and their providers, saying, here, click here, give us your password for PPE. What does that do to the relationship between the security team and the clinicians? And then when the vaccine came out, we saw again, some organizations were doing phishing tests saying, here, give us our passwords and we'll put you on the fast track for the vaccine. We caught you, you should never do that. Yes, we do need to make people aware of these things. I think it's important, yes, that we provide specific training and examples of what a phishing looks like and whatnot. But at the same time, I think we have to be very careful to not exploit the tremendous pressure that we're all under in order to make a point. I think at the moment, phishing awareness can very easily backfire and cause more problems than it solves.
Thank you, Wolf. And Connie, coming back to you, and you did say earlier on that you're very passionate about the training piece of this. So how have you been delivering the training or driving the training for the employees you have in your organization to be aware of these phishing attempts and also other attempts to gain access to their data?
Absolutely. And I just want to say, I completely agree with Wolf in the perspective that, you don't want to, granted, the adversary is going to have gloves off, right? They're not going to stick to any rules when they're crafting emails surrounding, whatever they're trying to exploit. But at the same time, from an educational perspective, you don't want to brand it in such a way or put language in there that a great majority of the people are going to fall for it, because you want it to be something that that they can learn and feel empowered instead of ashamed or embarrassed. I certainly so agree with that. We do phishing simulations quarterly, and honestly, in the way that we try to craft it, they're really very simple. They should be things that most of the population, if not all, recognize as, I shouldn't be receiving this type of thing at work, for example. And so what that's created is really a culture of empowerment. And, we find that people in a department are emailing everyone in the department, as well as, reporting it to IT security through this, through the phishing simulation, as well as other things that we do. Yearly security awareness, I believe everybody does that, right? But that's not enough. We publish monthly security tips, but also one of the most impactful things is that we have different road shows where we target specific departments and speak to them. And, my way and the way of our privacy office, because we work very much collaboratively very often, is that we say we're not here to point the finger, we're here to partner with you. And that's very much in the way that we proceed. And so we're very open, and that openness has really generated a huge candor from the user base. Users feeling confident to even, let VPs, up and down the strata of the organization to speak up. We have also a just culture throughout our organization. So, you can speak up and you're not going to be reprimanded or get in trouble, by saying the wrong thing, just so long as, obviously why you're saying it is for the right purpose. The other thing that I think that makes a huge difference is that we also have, from a human resources perspective, a framework called CARE. And so that CARE framework, we suggest to people, and this is trickling down the organization, to make security consciousness and security related goals throughout the organization for the different, employee levels. So not only is it something that we talk about, it's something that we model. We're, meeting with them in very close proximity, even if it's not physically, but through Zoom. We're in new resident orientation, encouraging them to reach out to me directly. And I think that really makes a world of difference. Last thing I'll say is that within that CARE structure that we have, we do a little thing called badges, where you can go online, send somebody a badge for doing a good deed, whatever you recognize within those guiding principles that we have. And so really, I have my staff, even though it's time consuming, making sure that, we have various moments that we're reaching out to the population and sending them a care badge, thanking them for reporting something. In that reporting aspect, I try to ensure that if, not to say you were wrong, but to educate them and say, perhaps this, in this case, was not malicious for this reason, but I thank you for being a security champion. Please make sure to continue to report. We rather have false positives than be in a situation that you're nervous and we could have mitigated damage, but you were hesitant to do so. So that I think it's really constant touch points. You really need your user base to know you. And IT security, I think, inherently historically has been a little bit inaccessible. So me and my team strive to be accessible, to be known, and to make sure users are comfortable with reporting anything and everything.
That's great. Thank you for that background. I'm going to come to you, Deb, in a moment. And part of what I was thinking when Connie was talking was, gosh, you have such a difficult job because you have these healthcare providers, healthcare workers, and all they want to do is get to patient care, right? And I remember, when I was in clinical practice, it was like, yeah, I got to do all that kind of stuff, but let me, I became a doctor because this is what I want to do. And not that you're annoying, but you're annoying because this is what I want to do, right? So how do you, Deb, in your organization, right, or in, the Silicon Valley, as you said, right? How do you organize and engage your providers to, it's less about care about this, but engage in what you need. I mean, it's just, getting healthcare as an industry is very federated, I'd say. But, how do you make your own job easier by working with all these clinicians in the healthcare system?
I'm all about making our jobs easier. That's awesome. I think people really do, physicians, clinicians, they want to do the right thing. And even though they're busy, they have this incredible desire to really do the right thing for patients and for the organization, and realizing, looking at real life examples of what has happened from attacks in our industry has really opened the eyes of the seriousness and I would say the accountability of each individual to help us. And what I've also heard from individuals is this not only helps me professionally, but it helps me in my personal life. If I can know good practices for email, what I do with certain emails, if I have good security practices, it helps me personally as well. And people are hungry for information, and so they absorb it. When we give it out, when we share it, it's extremely well received. We've made it easy for our individuals in our company to report issues. We've made that easier recently so that people don't have to email info security, but they can do it, report issues in a very quick format, so they can say, look at this email, what do you think? People are proud when they identify something that is malicious, and they often, and we reward them. We call them out, and we recognize individuals that have done well. So we've tried to, as Connie has mentioned, and Wolf, we try to not punish people, but we try to reward really good citizen behavior, and make it easy to report incidents and issues, and along with the training that obviously we provide.
Terrific. Thank you, Deb. I'm going to come to you, Wolf, in a moment, and really taking the thread that Deb said around employees being better in their own personal lives. And one part of this actually is more around the organization. But I remember, I can't remember which organization it was, but they said, you can't use your own laptop, you can't use your own phone, all this. I was like, but this, this is what I use, right? How am I going to get through the day without, my own technology? How do you, Wolf, think about the, technology is so disparate right now, and employees' personal devices, right? They may want to check something when they're out or they're on vacation or whatever, and they check it on their spouse's device, whatever. How do you think about that, and what's the risks of that from a cybersecurity perspective of employees using their own personal devices?
They check it from just about any device. I took a conference call during the pandemic, and I was looking, I reached up and looked, I'm like, are you in a nursery? And the person I was talking to was on a nice little pink chair, and they're like, yes, my daughter's done studying, I'm on her tablet. I'm like, oh, okay. Any device that's around, I guess, is a device that we're going to use. And the data bore that out. Before the pandemic, we're seeing around a little bit over 2 devices per user. Makes sense. Your corporate device, your personal device, or your corporate device, your phone. After the pandemic, that jumped up to over 6 devices on average. So a massive increase as people were using whatever device was available. There's a couple of things we need to do here, though, right? So one, we need to protect the organization. I'm going to come back to that in a minute. And 2, I think we need to honor the fact that people are much more tech savvy than they were. It's not when I got in where we're trying to take away the typewriters. To Connie and Deb's point, we want to engage folks. We want to respect them. We want to teach them how to do what they need to do. And at the same time, we need to make sure that any devices that can access sensitive data are either prevented from joining because they don't meet standards, or at bare minimum, pass the threshold set by the OCR. So they're encrypted, they've got a key lock, all those sort of things. So the approach that we've been taking is enabling BYOD devices for applications where it makes sense, maybe not everything, but for applications where it makes sense, and checking at the time that they connect for those types of things. Are they patched? Are they up to date? Does it meet standards? And if not, giving some feedback to the users. I know you want to get in, but you need to do some remediation. And I've actually found that that's been very useful for me. It's about the only way I remember to patch Chrome these days. I got 1,000,001 tabs open. I wait till I go to access something like, Wolf, you need to update. So it puts more of the power in the hands of the user. It encourages that collaborative approach that both Connie and Deb were mentioning. And I think it still allows us to both deliver IT services while protecting our organization.
So with this, with all these checks and balances that we need to have, just as you mentioned, you know, if you want to use a personal device, I know how I struggle with remembering passwords and all those kind of things. I think back to the early days when you probably only had one password, and now it's just everywhere, right? So how do we create, you know, let's start with our employees, and let's come back to you, Connie, but how do we create these logging experiences that aren't, you know, every third day I have to I've forgotten my password and I've got to remind myself what it is? Or the worst for me is actually when I've gone on holiday for 2 weeks and I haven't been typing it in every, 17 times a day. But put that aside, how do we kind of balance this with the security needs versus the user needs of just, I need to use my password, I need to use my devices, whether I'm at home or at work. How can we kind of level that?
Absolutely. And I think that's a critical question because, you know, for me, when it comes to employee mobile devices, personal devices, whatever type of device it may be, it's one of those things that I say the horses have left the barn because, you know, employees are going to use what they want if there's not a technical control to prevent it. And at the end of the day, employee satisfaction and ease of use is going to yield much better productivity, and it's going to allow the care to flow more seamlessly. So, you know, I think even before, I've been at Jackson now for about a little bit over 7 years, but historically, there's been a lot of work done in a homegrown identity and access management solution because there's so many different populations that, you know, we have to cater to. We've seen a lot of breaches, for example, with third parties having access to an environment long after they had no business relationship, things like that, or employee turnover. So we really have been able to build and craft a solution that works well for our employee population, our credentialed population, as well as contractor associations. And so when you have that kind of you know, structure and control over identity and access, we couple that with secure portals, whether it's VPN or whether it's, you know, micro VPNs for applications and things like that with 2 factors. So, you know, and also when we vet solutions, one of our main criteria is Active Directory integration. That happens to be our authentication mechanism, or things that can leverage federation, because we want to ensure that we don't have, you know, statistics say that most people have about 26 user IDs and passwords, and typically they're, you know, possibly only keeping 5 of them to be unique. And as we, you know, open our eyes every day, there's another major breach. We saw LinkedIn reportedly 700 million, you know, consumer accounts breached. How many of those people have the same password as their corporate password? That does happen, you know, and that is a problem. So, you know, using a very robust identity and access mechanism, trying to force or reinforce solutions that can leverage LDAP configurations has really allowed us to use SSO sometimes. Sometimes it's not necessarily a pass-through authentication, meaning we actually prefer for people to put in their credentials. And so depending what the data source is, depending what the application, what the risk profile, what device they're on, they may need to use the MFA, the multi-factor authentication. They may need to use 2-factor authentication, you know, but the point is that they don't need to remember 5 passwords, 6 passwords. They need to remember 1 credential. And, you know, so I think that's made a big difference for us. I've worked in other organizations that even in certain solutions where the user ID is not obvious. You know, it's basically letters and numbers. There's many solutions still like that out there today, where the IT group doesn't even know who it really belongs to. Just that mapping is a challenge. So I think that, you know, puts us in a very good position with standardizing on LDAP across the board. That also helps us when the other thing, if I may, I know I'm going a little long, but the other thing that I think is critical is that this homegrown code has allowed us, the moment somebody switches departments, that access, all of their groupings, all of their access needs to be re-requested by the receiving leader. From a clinical perspective, not to disrupt patient care, we do allow access to our EHR for 30 days within the new department. But if that new leader doesn't go through the right process, it'll get dropped. So
Right.
I think that's allowed us to really stay clean.
So we've talked a lot about kind of our employees within our organization, and Deb, I'm going to come to you. And really the question is, how do we think about our consumers, our patients as points of risk, and how can we reduce those points of risk from the inbound consumers, especially in the context of COVID and using, you know, virtual care, telehealth, and their own devices. You know, is that something that we should really care about? And if so, how do we care about it?
I think, you know, we do care about that, especially when we have visitors in our four walls trying to access different applications. And so obviously having a guest area of your network that provides that access, but does not provide ability for anyone to go further than that is so important. And I know we all have that. That's pretty standard. I think from, you know, for consumers coming in, we've put in controls, obviously, and when we use mobile devices, again, as I mentioned, cloud-based products have been very helpful for us, for consumers that are interacting with us. So really following those best practices has been a real help for us.
And Wolf, coming to you, how do you at Duo think about this kind of interplay between, you know, maintaining the security and then focusing on the employees that we can train, and then also having the consumers come in? And Connie also mentioned there's contract workers and so forth. So all of these different flavors of people are coming in to the system. How do you monitor that? How do you organize that? And how do you reduce the risk of just that huge mix that's happening every moment?
I liked what Connie was touching on towards the end of her answer with, you know, IGA, Identity Governance Administration. You need to have good role engineering. You need to have good RBAC. You need to have the ability to put people in the roles that they belong, and those roles need to be providing the access that's appropriate, as well as remove it when it's no longer valid. I think, you know, organizationally, we got good at that with employees. Contractors has been an emerging thing. Getting good at it with patients and consumers is the third area. And in all three of those areas, of course, there's different needs of those populations, but definitely good role engineering, good persona-based access is vital. That's on the authorization side. On the authentication side, we need to make sure we trust that person is who they say they are, right? That we trust them before we give them the access that has already been approved, has already been configured. And that's where you get into things like the multi-factor, you get into things like device trust, you look at the context and conditions of that authentication. So it's really this combination of the principle of least trust, and trust you the least until you can demonstrate otherwise before he lets you in, as a consumer, as a patient, as a provider, as someone in the back office, as well as least privilege. I've got a good role engineering effort, and I've got the ability to get you the access that you need once we can be assured that we can trust you and the device you're coming in on.
Great. Thanks, Wolf. And Deb, I'm going to come to you. And really the question is, you know, within our complex healthcare organizations, these threats don't just happen, when we hear about them on the news. These are, constant threats. How do you prioritize? Like, where's your threshold, or are there multiple thresholds for how you identify and then react and then review based on those threats that may be coming into your organization? Just almost take us through, like, what does a day look like for your organization from a cybersecurity perspective, and then how do you kind of manage that? Because we all know in healthcare we have finite resources, right? So give us a little sense of that kind of prioritization of resources and potential risk that you do within your organization.
Yeah, we rely heavily on some of our information that we receive from our partners on risks and threats and the severity and whether they're actually exploited in the wild or not. That helps us understand how quickly we need to act. And so we do rely on being very aware. I think awareness, security awareness, is not only just training for your staff, but it's awareness for your team and having those right inputs to your organization regarding the latest news and information. And so taking that in and then understanding, does this impact us? That's always my question. Is when I see a threat, I'm constantly asking my team, are we impacted? How are we impacted? And so understanding your list of applications, understanding what you are using is so important. Your asset management scenario is so critical to understand what you have in your ecosystem. And then, of course, understanding how to react and the necessity to react and how quickly. And so you can do all that in one day. You can hear of a threat, you can understand the urgency by the impact to your organization, and then of course address it, put the remediation plan together, and then act on it. And speed is really critical these days. No longer do you have 30 days to react to a vulnerability. It's we start talking about minutes now versus days. And so we are moving in that direction of being resilient and being able to react very, very quickly as we can.
That's wonderful, Deb. I feel hugely reassured by what you just said. So thank you. Thank you to you and your team for all that great work. Connie, anything that you'd like to add or that you might do differently at your organization?
Sure. So kind of a day in the life starts with our behavior analytics tool that pretty much prioritizes based on it looks very much like a Gardner quadrant where we have, certain criticality. So that's really where we start the tackling. It's also what we use for, threat hunting and finding any interesting crumbs. We certainly have playbooks to ensure consistency with processes. Also to be sure that nothing gets missed and that everybody does it the same. One of the things that is really valuable for a couple of years now, we know obviously the CISA grouping of CISOs get together, and we're doing a lot of work in different work groups. So that is hugely valuable because there's tons of information that goes out that way. The different ISAC groups that many organizations can participate. There's a lot of different ones to choose from, even in healthcare. And I think at the end of the day, even though it's not anything fancy, but I think it's critical to constantly be reevaluating from a vulnerability scanning perspective, because one of my pet peeves is always many of the things that happen have to do with lack of patching. Sometimes it's not necessarily an organization's fault because they may be stuck with a certain build for whatever reason, they can't afford to replace it, things like that. But I think it's unfortunate when we recognize that it's normal to have this super patch Tuesday scrambling that we have month after month when Microsoft patches. Why should that be normal? Why shouldn't we demand for it to be very different? And so I think that where we strive to push our organization is with finding vulnerabilities and getting everything patched and checking it again. Recently, we know that we have the principal vulnerabilities. There's a lot of vulnerabilities in the wild. We make sure our behavior analytics can account for that, and that we are patched or aggressively patching.
Great. Well, we only have 5 minutes left. This has been a terrific panel so far. And so I'd just like to open it out to Wolf and Deb and Connie. Is there anything else which, that to your mind is really top of mind that we haven't talked about that you'd want to, mention on this panel? And I'm just going to go around. Let me start with you, Wolf. What else haven't we touched on? Probably in about 60 seconds, that would be your takeaways or key topics on this panel.
So identifying threats is key. Information sharing is key. I liked everything I heard there. The other thing that we haven't talked about is response, and making sure the response can be quick and can be automated. I'll give you a really quick example. Back in the day, there would be an exploit on my phone population, and I'd have to meet with my comms people and send out the emails and hope I had a good device inventory and hope my users brought their phones in. And then I have to deploy the patch, and I have to follow up the people I missed. And suddenly, 4-6 weeks have gone by. That's no longer acceptable. In today's environment, in the way that my environment is configured, if there's a zero-day exploit or there's an exploit on the phones or the devices, they can't get in until it's patched, right? All access is blocked. May make some exceptions for that so we don't interrupt the business. But I think it's very paramount that we get away from these really long processes to really short cycles for remediating and for responding to threats.
Brilliant. So that rapidity of response, that's great. And Deb, coming to you, any kind of key takeaways or nuggets that we haven't talked about that you'd like to share on the panel?
I would just say, especially in healthcare, we have a huge responsibility to patients and to obviously keep their data safe, but to keep our systems running so that we can care for them effectively. And it just makes the importance of our work even more critical. And it really is the challenge that we have, and yet the opportunity as well.
Brilliant. Thank you. Really important comments there. And Connie, coming to you, same question to you. Any kind of key thoughts, key takeaways, any nuggets we haven't talked about that you'd like to share with the audience?
Yeah, I love everything the other panelists shared, Deb and Wolf, but one thing that really rang with me was when he talked about response. And I think, just coming from a music background, it's really important to practice. It's evident when people, even if they have the knowledge, but they don't have the practice, they'll fumble, they'll look like they don't know what to do next. So it's really important, whether it's purple team exercises, those are my favorite, but it's important to practice responses so that everyone can keep their cool, they'll know what to do, and they'll do it right.
Brilliant. Well, we're almost done with the panel. I'd just like to share kind of my brief thoughts, that what really resonated with me was how the employees, the patients, others really need to work together with you all as the kind of technology and security experts. And really my takeaways are very much around designing the compliance regimes proactively based on the needs of the organization. And you all said this, but really creating that culture of safety, avoiding those punitive mandates that may drive compliance issues into the dark. And that leads to creating a culture of continuous improvement. And then what I also heard was having an agile mindset to kind of iterate and reiterate. And, even as you just said, Wolf, around the response time, to be able to do things well, but also to be able to do things very efficiently to minimize those threats. So I think this has been a really terrific panel. I've learned a lot, and I'd like to thank my panelists, Wolf Gerlich, Connie Barrera, and Deb Morrow, and really appreciate the time, and thank HealthIMPACT Live as well for the opportunity to talk about this really important topic. Thank you so much. Bye.
Thank you.
Thank you.